and bringing you really important information about community health. Children's Healthcare of Atlanta is expanding access to pediatric care in some metro Atlanta communities, some of the fastest growing and most underserved communities. The hospital system is opening a new primary care clinic in Adamsville next month and then planning a larger pediatric presence in Union City. Ron Frieson is the Chief Operating Officer at Children's Healthcare of Atlanta, and he joins us now to talk about that expansion and just how important it is. Ron, thank you so much for joining us.
Thank you, Caitlin, for having me.
I want to talk first about the decision to do this expansion. Can you talk through what was going through the minds of people at Children's Healthcare of Atlanta when you were mapping out where you wanted to go next?
Sure. So we've got a strategy where we want to get closer to a lot of our patient base. And by doing that, we take a look at the demographics, we take a look at the geography, and our core principle is that we really want to be sure that we are within 30 minutes of most kids in the metro area.
Within 30 minutes is incredible because I know so many people are willing to drive really far for care from Children's Healthcare of Atlanta. It's really important that their kids get that expertise and that level of care that they really want. So they're willing to drive further. That commitment to be within 30 minutes is really admirable. Can you talk about why that's so important to the community?
Well, it's about access. We want to
Mhm.
be sure that there aren't any barriers to kids, especially kids, being able to get the kind of health care that they deserve. Being the only freestanding children's hospital in this state, we believe that we have the level of expertise that all of our kids need to be able to come and see us.
I love that. Can you talk about why Adamsville was selected as the next location?
Sure. So Adamsville has a demographic that is somewhat underserved in terms of other private pediatric practices. So as we looked at that particular area, we thought it would be a great place for us to go and bring a teaching program there. So not only will you get benefit of the providers, the nurse practitioners, but also learners. And that's extremely important to us because that will be the next generation of physicians.
Ah, what a great point. Can you talk about some of the facilities that are going to be there and what services families are going to have access to?
Sure. Well, this will be a primary care office, which means that you will be able to go there and get your physicals. You can have your regular checkup appointments. We'll be able to do some level of both autism and behavioral and mental health over time at this particular facility.
That's so important to so many families. Can you talk about the need for access in the South Fulton communities, Southwest Atlanta? Why is it so important to get facilities right there?
Well, I think most of us understand the facilities that have shut down over the past couple of years, which has made it even more difficult for people south and west of the city to get the kind of health care that they deserve. So, along with Grady, we have spent a lot of time thinking through how we can make our presence greater in order to fill that void.
I love that. How does bringing pediatric care closer to communities have long term good health outcomes for kids?
Sure. So if you think about kids getting on a regular schedule of seeing their physicians, long term, obviously you're able to catch things that you ordinarily wouldn't if, in fact, they weren't coming in to see the physicians. Primary care is great because that becomes their home for whatever they need from a health perspective. And then, of course, we have a network of specialists. So we are able to refer them to specialists for any issues that they may encounter.
I think this is so important. We really appreciate your time and expertise. Thank you so much for joining us this afternoon.
Thank you for having me.